If you're from Europe and thinking about moving to the United States, there's one topic that always comes up, and it's not the food, the weather, or even the job market. It's healthcare. You've probably heard stories about sky-high medical bills, complicated insurance, and people going bankrupt just from getting sick. But what's the real story? Is American healthcare really that different? And what do you need to know before you arrive? Today, I'm breaking down the truth about US healthcare for Europeans, what's shocking, what's confusing, and how to protect yourself. Let's start with the basics. Healthcare in the US is not free. Unlike most European countries, there's no national health service or universal coverage. Instead, the system is a mix of private insurance, employer plans, government programs, and out-of-pocket costs. That means you have to plan ahead, and you can't just walk into a doctor's office and expect to pay a small fee or nothing at all. Shock number 1. The cost. This is the big one. Healthcare in the US is expensive, sometimes shockingly so. A typical doctor's visit can cost $100 to $300, and that's before any tests or treatments. An emergency room visit? Easily $1,000 or more. Hospital stays? Tens of thousands of dollars. Even simple things like prescription medicines, dental care, or eye exams can be much pricier than in Europe. One of the most surprising things for me was how unpredictable the costs can be. You might get a bill weeks after your visit, and it's not always clear what you're being charged for. And yes, there are stories, true stories, of people being billed thousands for an ambulance ride or a broken arm. Shock number 2. Health insurance is essential. In the US, most people get health insurance through their employer. If your job offers it, take it. It's usually the best deal you'll get. If not, you'll need to buy your own plan, either through the government marketplace, healthcare.gov, or directly from an insurance company. But here's where it gets tricky. Insurance isn't free, and it isn't always cheap. Monthly premiums can range from $200 to over $1,000, depending on your plan and where you live. And even with insurance, you'll still pay out-of-pocket costs, like deductibles, co-pays, and co-insurance, every time you use healthcare. What do these words mean? Premium. What you pay every month for your insurance, even if you don't use it. Deductible. The amount you have to pay each year before your insurance starts covering costs. Copay. A fixed fee you pay for certain services, like $30 for a doctor's visit. Coinsurance. A percentage of the cost you pay after you've met your deductible. It can be confusing, even for Americans. The key is to read your plan carefully, ask questions, and know what's covered and what isn't. Shock number 3. Not everything is covered. Even with insurance, not everything is paid for. Some plans exclude dental or vision care. Mental health services might be limited. Certain medications or treatments may require pre-authorization or may not be covered at all. Always check before you get care, and if you're not sure, call your insurance company. Shock number 4. Networks and paperwork. In the US, insurance plans have networks of doctors and hospitals. If you go out of network, you could pay much more, or even the full cost. Before you see a doctor, always check if they're in your network. And get ready for paperwork. You'll get explanation of benefits forms in the mail, bills from different providers, and sometimes confusing statements that don't look like bills but actually are. Keep all your paperwork and ask for help if you don't understand something. Shock number 5. Preventive care is encouraged. Here's some good news. Most insurance plans cover preventive care, like annual checkups, vaccines, and screenings at no extra cost. Take advantage of these benefits. They can help you stay healthy and catch problems early. What should Europeans do before moving? Research your options. Find out if your employer offers insurance and what the coverage is like. If you're self-employed or job hunting, look at marketplace plans or expat insurance. Budget for healthcare. Include premiums and out-of-pocket costs in your monthly budget. Bring your medical records. Ask your doctor at home for copies of your records, prescriptions, and vaccination history. It can save you time and money in the US. Know the emergency numbers. In the US, 911 is the number for all emergencies. But remember, ambulances are not free. consider travel or expat insurance at first. If you're not eligible for US insurance right away, temporary coverage can protect you in case of an emergency. Tips for surviving the US healthcare system. Always ask for prices up front. Don't be afraid to ask what something will cost, even if it feels awkward. Use urgent care clinics for minor issues. They're cheaper and faster than emergency rooms. Find a primary care physician. This is your main doctor, and having one can save you money and help coordinate your care. Use generic medications when possible. They're much cheaper than brand names. Stay in network. Always check before making appointments or getting tests. Some surprising positives. While the US system has its flaws, there are some upsides. Wait times for specialists can be shorter than in Europe. Technology and medical facilities are often state-of-the-art. If you have good insurance, you can access world-class care quickly. But the bottom line, the US healthcare system is complex, expensive, and very different from what most Europeans are used to. But if you do your homework, get the right insurance, and ask questions, you can avoid the worst surprises. My final advice: don't move to the US without health insurance. Read every document and ask for help if you're confused. Take care of your health, prevention is key, and remember, you're not alone. Every newcomer struggles with this at first, but you'll get the hang of it. If you have questions about healthcare in the US, want to hear more about insurance plans, or have your own stories to share, drop a comment below. And don't forget to subscribe for more real-life tips about moving to the United States. Thanks for listening, and I'll see you in the next one.
Thanks for watching. We hope you found this video helpful as you prepare for your move to the United States. If you found value in the information and advice provided, please consider supporting the podcast on Patreon. Your donations will allow us to continue creating new episodes and videos to help even more people with their relocation to America. Just visit patreon.com/movingtotheus to sign up. Until next time, best of luck with your move.